from the station that's on your side. This is Channel 7 News Daybreak.
Well, menopause is a life-changing process for middle-aged women that is surrounded by myths and misconceptions. And joining us this morning with some great advice is Baptist Health OB-GYN Dr. Brian Burton. So, Doctor, thank you so much for being here.
Thank you. I'm glad to be here.
This is a pretty hot topic among people my age especially. Let's get down to it. Can you just quickly tell our viewers what is menopause and what kind of symptoms people deal with?
Menopause is a natural state of life, right? In women, when their hormone levels drop below a certain amount, they go through symptoms of menopause, right? This happens typically around age 52, but it can happen in women as young as age 35, right? We call it a little bit different thing, premature ovarian failure, but it's a natural phase of life, one that you cannot avoid.
Yeah, and what kind of things do women of that particular age group, what kind of things are they dealing with, and how do you best manage those symptoms?
Sure. So the common symptoms are hot flashes, night sweats, decreased energy. You hear patients talk about a brain fog and loss of memory, and you hear women talk about just difficulty functioning, right? These hot flashes and night sweats make people tired during the day. They just make them irritable, mood swings, all those
fun things that we get to deal with.
Right.
And you know what, though? This is encouraging to hear this, because I think a lot of women of a particular age, they experience these things and they think something's wrong with them, or they think, gosh, why am I so tired? Maybe I'm not eating right, or maybe not. Maybe it's just menopause or early onset menopause even. So can you talk, you said 35,
right,
which is quite young.
It is.
So talk about that.
Well, first of all, that's not very common, thank God, right? But it's very common for women in their late 40s, mid 40s to start experiencing symptoms. I think the key is to just be able to talk about it, right? Not just with your girlfriends, not just with somebody that you want to get on a blog with, but to talk to your doctor about it, because it's really important to make sure that these aren't other symptoms from another disorder, right? And so we see that not uncommonly. I mean, we diagnose thyroid disorders very commonly in these situations. You know, the overall benefit of hormone replacement therapy is there, but it's not for everybody, right? And so there's just conversations that you have to have.
And when should you go to your physician and say, I think I need some help managing this?
So we've seen over the last few years lots of pop-up hormone replacement clinics, and we see these hormone pelleting, and we see all these quick fixes out there. The thing to remember is that there is very ever rarely a quick fix in anything. You know, if you look over the years at all the health things out there, there is no quick fix, right? The key to going into menopause is to be ready for it, right? The healthier you are, the more active you are. If you're exercising, lifting weights, if you're eating well, those are the things that are going to get you into it.
Do all the right things, know it's coming, and know that doctors like Dr. Burton are here to help you and guide you through it. So thank you so much for joining us this morning. You can contact Baptist Health by going to baptist-health.com or calling the Baptist Health line at 1-888-BAPTIST.